Good afternoon, everyone. It is 12:32 p.m. on December 7th, 2023, and I would like to call to order the regular meeting of the Spokane Regional Health District Board of Health. Ann, would you do a roll call for us?
Mayor Kevin Freeman,
Present.
Commissioner Josh Kearns,
Here.
Commissioner Mary Cooney, Commissioner Amber Waldrop,
Present.
Dr. Alicia Panacali,
Present.
Board members Charlie Dornona and Christopher Pattison are not at the meeting today.
Thank you. So let the record reflect we do have a quorum of the membership present today, and so at this time we will do board reports. Today's chair report is my final chair report, and I'd like to thank everyone for the opportunity to serve the Spokane Regional Health District and Spokane County. I've enjoyed my time as chair of Board of Health. We'll look back fondly on it, and am grateful for the support I've gotten from my fellow electeds and citizen members during that time. I would specifically like to say thank you to all of the wonderful staff at Spokane Regional Health District who are incredibly committed to their mission and to public health in general, and to the overall health of Spokane County and the community. So thank you very much, and it has been a sincere pleasure serving as on the Board of Health. So thank you all. I also,
Before you go on, I think.
Yeah, Mr. Chair, I would like to share a few things for the tens and tens of people watching from home and the many people in the room here with us. Some folks might not know that Mayor Freeman actually joined the Board of Health in April of 2014, and he has served as vice chair 3 times, and he has also served as chair of the board 3 times, that being in 2016, 2017, and then again in 2023. In addition to his service on the various Board of Health committees, and also he served on the selection committees that hired Dr. Clark and Dr. Thompson. And I think I can speak on behalf of the board by saying thank you so much for your years of service, your dedication. You have guided this board very professionally, and I think we are also very proud of everything you have done. Thank you.
Say something, say it here. That one. Oh. Yes, you do.
Yes, you do.
There we go. I think it's working. So I just have to say, you coming in vice chair behind me and becoming chair as when I was a new commissioner, you were so helpful. I wouldn't have been able to do it without you. And so appreciate that when the commissioners, tasked you with being our elected on the board at large, that really appreciate all that you've done. And there is a card that is going around the room that will be coming to you that I couldn't go bring something in, so you have a gift card. So.
thank you so much. Thank you, everyone.
You're not done. So, on behalf of the executive leadership team, I actually have a letter to go along with your plaque. And I'm not going to read it all because some of the key items of strategies have been mentioned, but I do want to say a couple of things that I think are very important. One is we do know that, as a general rule, being a board member is challenging and demanding. And we do know that over the past few years, the role has been even more complex than it has been in the past. But we do know that regardless of the difficulties, you always distinguish yourself by your constant engagement, support, effort, and tenacity. And we as a team appreciate that. I'm not here in case anybody's looking for me. I'm just kidding. We do know that you held multiple seats on the board. We're thankful for that. You brought a level of expertise and historical knowledge that has been very, very, very important. We'll be sorry to see you go. And specifically over the last year, in the absence of an administrative officer, you took on additional support of the deputy administrative officer, the financial officer, and myself, and we certainly appreciate that. You will be sorely missed, and we wish you all of the best in the next chapter of your life. Thank you, sir. On behalf of the executive leadership team, and
Oh, yes.
pictures. Somebody wants a picture.
I go over to that wall and take a picture with everybody.
Different for lunch.
Thank you, everyone, for the kind words. That was unexpected, so thank you very much. So committee reports. I'll ask Commissioner Kearns if he'd like to say anything. I know we have the legislative agenda on for today.
We have not met since our last full board meeting, but yes, as you stated, we'll be adopting the legislative agenda that was drafted by the committee.
So Budget and Finance did not meet at the last regularly scheduled meeting. I did, as the chair, review the vouchers for October that are presented today and as part of the consent agenda. There was nothing unusual discussed with Ms. Kramars and would recommend accepting and approving those vouchers as part of the consent agenda. That's it. Oh, one thing from the chair. I would like to say my thank you to the county commissioners here for considering the resolution that was presented forward from the Board of Health, particularly in open session. I think you all did an excellent job of explaining why keeping the current format is your preferred way of operating. And I think I appreciate you taking the time to consider the request and providing some context for the public in why you as the county keep the board the way you're keeping it. So thank you very much for that. That was, regardless of the decision, that was very much appreciated by myself personally. So thank you. With no other committee reports, let us move on to our action items today. Our first action item is the consent agenda, consisting of the meeting minutes for October 26, 2023, October 30th, 2023, and November 6th, 2023. The October 26th was our regular meeting, and then we had a special meeting on October 26th? No. October 30th was the regular meeting. No, it was the special meeting. So it's two special meetings on the 30th and the 6th, and the regular meeting on the 26th. The October vouchers. A contract, which is the Spokane County interlocal agreement regarding the use of solid waste tipping fees for sampling, testing, cleanup, and disposal of residential solid waste resulting from the Gray and Oregon Road fires, and the correction to the Resolution 2503 adopting an SRH 2024 SRHD budget, which was a Scribner's error, correction of a Scribner's error. Would anyone like to take any of those four items separately?
I do have one correction to the October 30th minutes. Under where it says executive session, it says the board adjourned at 8:12 p.m. until 3:45 p.m., so that should be a.m.
That's a long meeting.
8:12 a.m. But that's the only correction that I saw.
So do we need, is that just a note, Ann? Okay. So if nobody has any objection to making the date right,
So moved.
is there a second? Moved and seconded. Any discussion? Seeing or hearing none, all in favor?
Aye.
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 Are there any opposed? Hearing none opposed, the consent agenda is passed unanimously. Thank you. And this brings us to our executive session today. We do have an executive session. Ms. Fossum, would you like to call it out and project some time?
Absolutely. So the board will be in executive session for approximately 15 minutes to discuss litigation / potential litigation pursuant to RCW 4231.10(1)(I). In addition to the board members, I would recommend that we have our Deputy Administrative Officer, Lola Phillips, stay, and myself.
So 15 minutes from now, if we could ask members of the public to depart. If we need additional time, we will announce, and then we will call folks back in at the conclusion of the executive session. Thank you very much. It is 1 p.m. and the board has returned from executive session. No action was taken during that executive session, and no action is pending from that executive session. That brings us to our action items. Our first action item today is Resolution 2309, authorizing a 2024 general fund budget amendment. Kim Kramars, our financial and director and comptroller.
Good afternoon. This amendment, Resolution 23-09, is proposed due to last month's budget meeting and the recommendation by the board to take some of our unassigned reserves and support the DPR division and specifically epidemiology program for 2 positions. And the amount is $167,555, which is a little bit less than I believe our meeting we discussed it being $173,000. So this is just proposing our original budget of $54,611,263 increased by $167,555 to $54,778,818. So we're requesting approval of the resolution.
Any questions for Kim on this? Thank you. Is there a motion on Resolution 2309 as presented?
Move to approve.
Second. Moved and seconded. Any discussion? Seeing or hearing none, all in favor?
Aye.
Aye.
Any opposed? Hearing none opposed, Resolution 2309 is passed unanimously. Thank you very much. And that brings us to our next action item, Resolution 2310, adopting a Board of Health legislative agenda for 2024, for the 2024 State of Washington legislative session. Ms. Phillips.
I apologize because last session went so long that many of the board members were not able to actually see the presented legislative agenda. But today, I'm hoping that everyone's had an opportunity to look through each of these items and looking for the board to pass approval on this as the adopted agenda for 2024.
Questions?
Yeah, I just wanted to make sure that the legislative committee or the policy committee had reviewed it and recommended approval.
Yeah, no, we did. We actually did last month, I believe, prior to the last full board meeting. Yes, is when we put the finishing touches on it. Yeah, staff was great at assisting us with it. We used the 2023 ledge agenda as sort of our jumping off point. Kind of looked through that and so, okay, what did we accomplish? Take those things off. Are there any things that have arisen over the last 12 months? Let's add those on. And so that's essentially how this was crafted. There is a lot of similar language to what was in last year's ledge agenda, but this was sort of a refresher to bring it up to date.
Thank you.
Any other questions for Ms. Phillips or Mr. Kearns? So is there a motion from the board on Resolution 2310 as presented?
So moved.
Is there a second?
Second.
Moved and seconded. Any discussion? Seeing or hearing none, all in favor?
Aye.
Aye.
Are there any opposed? Hearing none opposed, Resolution 2310 is approved unanimously. Thank you very much. And that brings us to item number C, a direction to staff to begin the Spokane Regional Health District Board of Health appointed member application process. So that one is mine. So right now, the current 3 appointed members' terms are coming to an end, and as per the WAC, governing appointed members of local boards of health, it is time to reopen the application and selection process. Included in your packets was the previous group of applications put together, and then is also included in here Chapter 24690 of the WAC local Board of Health membership, which includes selection process, qualifications, et cetera, for non-elected or appointed members. The staff can begin the solicitation. There's some guidance to advertising the positions, interviews, and then the selected candidates would then need to be approved by the Spokane County Board of County Commissioners prior to them taking their seats. It is allowed that members, current appointed members, can hold over until such time as new appointed members or returning appointed members are reconfirmed in their roles. It is our understanding that 2 of our 3 appointed members will not be seeking reappointment, so or will not be seeking their current tranche position, and so. Lola, do you have any thought on if board gave direction for you to advertise, when these advertisements would go out, and kind of when you would think a pool might be available for interviews, et cetera?
I think the first discussion would be kind of the timeline that we would need to get a minimum of qualified applicants. What we would like to see as the district is that new board members be ready to be placed by the 15th of February, which is the first committee meetings that they could sit on. So working back from that timeline, that gives us no more than about 3 or 4 weeks of time to air. We are pretty much prepared to move forward with getting those posted right away, though.
Questions for Lola? Commissioner Keating.
So I guess with that date, do you have what the timeline actually is as what you'd propose to open it up?
So I would request that after reviewing the documentation that's been provided, including the application documentation and so forth, and the questions, that we would be allowed to begin immediately posting as of next week, if that's possible for the team. And I would defer to Ann Pitznagel for a timeline for getting that with communications.
So I guess my question, just because it goes through, the interviews occur, my understanding, with the Board of Health, and then the Board of Health makes a recommendation to the Board of County Commissioners to get it. I mean, I don't have a calendar in front of me to know what that is. Is that in my packet and I missed it?
So no, we haven't.
Okay.
We haven't actually
Okay.
built a timeline yet, knowing that we would have to potentially have at least 2 special sessions between now and the 15th, unless we make a decision that that the appointment would take place after the 15th of February. So I think that's really a board decision.
Okay, so I guess what we need is a calendar in front of us to actually look at and go back to see if we can make that happen, or, okay.
Well, and it has to meld with the
Yes.
county commissioners' meeting schedules too for interviews.
Right. So yes, it would have to go the 6th
The 6th of February.
for BOCC.
Yeah, that was my comment, Mr. Chair, would just be give people a little bit of time in January, because the holidays, people just kind of, you know, have a lot going on, and it's hard to sit down and finish that application maybe till after the new year.
Well, the commissioners are the board, or the majority of the, you know, I think part of it has to be, you have to make sure that, and that depends on if you folks are gonna you're holding over in your same positions, or,
That gets determined next week.
so I guess it depends on who is holding over who is on the board for the county commissioners, what their schedules look like, because they'll have to be present at the interviews, unless there's not a requirement for interview panel size, is there? So you could have an abbreviated interview panel if you wanted. I mean, it doesn't take the full board to interview. I'm just saying that there are options if you decide to do something else for interview panel, if you can't get everybody there.
Right. No, but if we targeted the week of January 22nd through the 26th to do interviews, because otherwise you want to have enough time to, that you, if we need to, we could go into that next week before it goes to the county commissioners on the 6th. So you kind of want a 2-week window, I think.
So it
And
looks.
can I just ask a question? So there's no RCW that guides the actual interview or what you want to do. That's totally up to you. Okay. But when you say we, do you mean this board, or, okay.
Yes. But it would only be the electeds on the board interviewing, because the others are not. I mean, it's,
Because even if somebody is reapplying or wants to go for another 2-year term, they're required to reapply. We can't
Right.
just say,
So they
okay,
can't.
you get to continue.
So
They
I
have to
don't
go
think-
through the process, I believe. That I don't know.
my thought was, no, since you're, but I don't know. It's like, it's not the most well thought out legislation. It would have been better just to leave it how it was, but.
So, at a minimum, it would appear that this board needs to direct district staff to begin the recruitment process with a target of getting applications, final date to submit applications is January the 18th. I think that would probably be the best place to start, and then work to finalize the other details as you determine a pool of applicants and interviewers' availability.
So we do have an application that's in the packet for the board's review. In terms of the questions, I don't think that those have to be approved today. We do have some time for the board to kind of formulate the standardized questions they want to use, but we would want to make sure that those are prepared prior to the 18th or by the 18th. We did not. That is correct.
Yeah, well, and I would recommend as the recruitment goes out, that we figure out amongst it's really the three of us at this point in time, what a schedule would be for interviews, so that way we could put that in, because we need to give people the opportunity that that's when we'll be providing time for the interviews.
So,
And those wouldn't have to happen at a Board of Health meeting.
They have, it's a special meeting to do the interviews.
Right, but it doesn't have to be on the fourth Thursday,
No,
regular
No.
meeting.
no, it'll be a special meeting.
Got it.
That is still a public meeting.
Yes.
They're public interviews.
so if I could offer a motion, I think to get this started, I would offer the motion that this board directs staff to use the existing application as presented in the packet to begin recruiting all 3 tranches of the appointed membership, with application deadline to close January 18th, 2024.
I will make that motion.
I'll second.
Moved and seconded. Any discussion? Seeing or hearing none, all in favor?
Aye.
Are there any opposed? Hearing none opposed, that motion is passed unanimously, so we will leave that to Ms. Phillips to begin the recruitment process. Thank you.
Mr. Chair, so I'm just going to ask, because so we can expedite
Sure.
to help with the process, is since January 25th is our next Board of Health meeting, if we would be able to do interviews that morning. It'd just be Board of Health day. I don't think I do either, so that might be kind of a good way to do it, and that gives then, time from the 18th to the 25th to get packets together and make sure people can be there. And I think I would just want to make sure that in the application process, people know that it's a open public meeting that the interviews are, because there's some people that would choose. I mean, it's just our requirement. It's a state requirement. It's not that we want to do it. That it is a public meeting, and so the public can be watching those interviews, and that may, some people may choose not to sign up because of that, but I would like to make sure everyone is aware, because we did have.
I would also suggest that because of the process last time, you may want to clarify if this is going to be an in-person interview or if it is going to be remote, because when this was done last time, they were remote interviews. So there is that aspect of this. If you're going to ask people to actually come down here and participate in a in-person interview, you may want to make that clear as part of that process as well.
Yeah, and maybe to allow the opportunity for more, I'm happy with a Zoom interview process that we did last time. We were all on Zoom to make it easy.
Yeah, so especially if some of our applicants are kind of putting in PTO or something, taking an hour off to do the interview. It may be more convenient for them to Zoom in rather than drive down here. But also, so if it closes on the 18th, we need also, we're all just going to have to be willing, we're going to need to look at those packets and narrow down who we want to interview as quickly as possible to, again, give the applicants that are chosen to advance to the interview process enough time to get their schedule in order so that they can make it. So just also keep that in mind as well.
Yeah.
So Commissioner Kearns, does that require an additional special meeting just for applicant review?
I'm trying to remember how we did it last time, and I don't remember.
Previously, it was done in 3 special meetings. The first meeting was to choose the applicants to be interviewed. The second meeting was to choose the interview questions. And the third meeting was the actual interviews. And then, so if we're doing it on the 18th, if we have enough applicants and we need to narrow it down, we'll have a special meeting before the actual meeting on January 25th.
Can I suggest that the board, given the timeline, consolidate 2 of those meetings using the base questions we have now just for review prior to interviewing or prior to selecting applicants so that we don't have to have a 3rd meeting.
No, I would suggest that too, because I think we do have the questions down from last time. We were trying to develop the questions. It was a new process last time. So we were developing those questions. So I think those questions can go out to all the board members that will be on the interview process to give input. And I would suggest that that input is provided by the 18th, so that way it can be accumulated. Michelle, did we have you do that last time? Or
No, the questions were turned into Michelle, who had them, and then they
made sure we're meeting all the legal requirements of it. So if we could get those and then have that those questions would be due back to Michelle if anyone wants to change anything by the 18th, so she can accumulate that before our special meeting to review the applications. And so now we need to pick a date to review the applications, because I'd like to just have it all taken care of now. I know you will. I don't know if we have an.
Are we setting our values, all of our meetings next week?
Yeah. But we could do Monday afternoon. Afternoon. Yep.
If we have a strategic.
If we do, it would go all morning. So
Right. I mean,
so
we may or may not, but
So I-
schedule it early afternoon.
yeah, I'm saying 2 o'clock on Monday the 22nd. And that would be in person here at the health district.
Do we want to set a time?
I would say if we convene at 8 and start at 8:30, or, you know, if we convene 20 minutes before, it just, so someone's not right on at 8, but start at 8:30, just, we've got 3 groups that we have to get through.
On my calendar. Oh, right. Got it. That works.
So we would want to officially start the meeting. We can figure that out, but I mean, I would say start candidate interviews at 8:30. And then we might get on 5 minutes early just to make sure that we've got a quorum and all of that, since we're on Zoom. So do we need a motion for the process, or have we defined the process enough, Michelle? Okay, I'm going to just clarify, just to make sure that we're all on the same page. So we're going to open up the interview, the application processes, and close it. So I'm not sure when you're going to open, but we don't need to have the exact opening date at this point, because you're going to open soon. But January 18th will be the close of the application date. And then on Monday, the 22nd, we will have a special meeting at 2 o'clock in person to review the applications. Prior to that, though, the interview questions will be sent out to all the board members and are due back to Michelle by the 18th if you have any changes to the interview questions. And then on the 22nd, during that special meeting, as we go through the applications, we will also confirm, because we don't want to give the questions out ahead. We will just confirm that there was changes or no changes to the questions, so that they won't be in the public meeting, I think is how we did it last time, so they weren't out ahead. And then on January 25th at 8:25, we will start a special meeting on Zoom for interviews that will go as long, yes, the interviews themselves will be on Zoom. So, similar to last year, so that way somebody can zoom in. So I think just I'm good with all of us being on Zoom. I think it worked fine last time. Yeah. Yeah. Yeah, because it's hard for them if we're sitting here to see who's the responses. So I think on Zoom, they can see everybody's. Yes, exactly. So I would say that January 25th, that meeting will be Zoom for everybody, which Ann gets to help kind of get people in and out for the interview side. And then we hope to have a decision made. Are we making that decision on the 25th then to move as to who we will move forward to the Board of County Commissioners? Just confirming. Okay. Yep. So then we will discuss and make a recommendation to the Board of County Commissioners on the 25th. February 6th, then it will be in front of the Board of County Commissioners to make a decision. And then I will say hope because it'll just depend on if the county commissioners make a decision or not, to have the new members in place by February 15th.
So the January 25th meeting, you do the interviews in the morning. Are you going to go right into the regular scheduled board meeting and have that on Zoom, or are you going to switch that up and then have it in person?
Well, my memory last time it was like 2 hours that we were in interviews. I mean, our interviews weren't. I think they were like 15-minute interviews. They weren't really long interviews, if I remember right.
That long?
So I mean, I think my hope is that we would get through all the interviewees and make a decision, and then hopefully we can all get down here. Otherwise, we'll be zooming into this meeting.
Can I just check, just to clarify, are you sure our February meeting is the 15th and not the 22nd? The 22nd's the 4th.
The February meeting is, that's referenced as the executive committee that
Okay.
sets the agenda.
Okay, so that's why we want them prior to the executive committee, not necessarily,
Correct.
okay, that's
And then
that's the
gives-
date
yeah.
we're hitting.
That
Okay.
gives us time to onboard them as well.
Got it.
before the meeting.
Yeah, before. Okay, I think that clarifies. Okay.
Any other questions, comments, concerns regarding this matter? Ms. Waldrop?
So what is the process for appointing the elected member then? By the, 'cause
I
I'm
think.
new.
I think that is going to be up to the Board of County Commissioners. So I think we'll bring it up at next week's meeting.
All right. So to that end, which flows forward from here, which is the next action item we have, the election of the 2024 Chair of the Board of Health. Historically, the sitting vice chair is the next chair of the Board of Health. And so that is Commissioner Kearns to my right. However, we always open it up for nominations in general, but if somebody would like to nominate themselves, someone else, or Commissioner Kearns, I would be open to a nomination.
I move to approve Commissioner Kearns as the next chair of the Board of Health.
Second.
Moved and seconded. Any discussion? You want to campaign for it?
Or,
All right.
or against.
So, we have Commissioner Kearns. Do we have any other nominations? Seeing or hearing none, all those in favor of Commissioner Josh Kearns as the next chair of Board of Health, please say aye.
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 Are there any opposed? Hearing none opposed, Mr. Kearns is now will be the chair of the Board of Health. So that leads to the election of the vice chair.
I move to appoint Amber Waldrop to vice chair.
I second.
Moved and seconded. Were there any other appointments? Motions for appointments. Okay. Moved and seconded. All in favor?
Aye.
Aye.
Are there any opposed? Hearing none opposed, congratulations, Commissioner Waldrop. You will be the next vice chair of the Board of Health. Thank you very much.
Now I have a committee that I'll have to go to, right? Another committee meeting?
Yes.
All right.
Oh, yes.
And Commissioner Cuny no longer has to go to those meetings. That's all right. We'll pass the baton. All right.
Now, can I just speak to
Yes,
that?
please.
So thank you both, because, I mean, we kind of, with this new structure, which is why I will just say once again, the old structure was really good, that we are limited in who can be the chair and vice chair. So it really comes down to, with the appointments being every 2 years, that's not enough time to do that. And so that's, so I appreciate, Josh, you continuing as chair, and Amber coming on as chair, because I, like Kevin, I was chair for 2 years in a row there. So thank you. I appreciate both your willingness to serve.
Any other comments? All right, so that concludes our action items for today, and that brings us to our reports. First up is our administrative officer report given by our deputy administrator, Ms. Phillips.
Right. So normally we do not do kudos this time of year, but we have had so many amazing staff that in order to not overwhelm the last few meetings, we've split these up. So I am going to just continue on from the last meeting with giving kudos for staff that are remaining from the 2023 very active year. So first is, the wrong page, Christian Montiel. Christian on the IT team has been an absolute and total lifesaver to our team the last couple of months as we have faced challenges with our phones, hardware, and software. He is so incredibly helpful, efficient, and patient with us, as IT is not at all our area of expertise, and we have had some time-sensitive needs that he fixed for us. We are grateful for Christian and the rest of the team for the support they provide. So Mia Morton and Isabel Main, these kudos are for Mia and Isabel for their excellent work on the sudden unexpected infant death prevention materials trainings. The intentional way Mia engaged with community partners, tested messages, and provide language access shines through and is a great example of how to center health equity into our work. And Isabel Main helped to organize the event. Great job, Mia and Isabel, but there is an additional kudos for Mia for her diligent and professional work to update the SRHD materials, educating professionals and parents, caregivers on safe sleep practices to prevent sudden, unexpected infant deaths. She's also helped develop a land labor acknowledgement for the training that will continue to be worked on with the health equity team and community partners. Mike Lashula, kudos to Mike. His expertise and willingness to get us information for the website and wildfire debris press release was invaluable. Really, anyone who put an extra effort that weekend and the week following should be recognized. SRHD really shined. Larry Johnson has been promoted to the purchasing and AP and grant billing manager in February. Larry has energetically embraced his new responsibilities. He has provided guidance and understanding to his employees, as well as contributed improvements to the purchasing process he oversees, while continuing to ensure the grant billing function is accomplished accurately on time. Thank you, Larry. Carolyn Nordahl. I'd like to extend kudos to Carolyn Nordahl, who achieved her full counseling credential from the state. What this means is that Carolyn passed her licensure examination and completed all requirements to achieve the ability to practice independently. This is the goal for every master's level therapist. Sadly, prior to posting this, kudos for Carolyn, she had passed on. And so I just wanted to make a statement that she will be missed by her team and everybody that knew her. Kudos to the NFP nurses. Their work with clients is phenomenal, and despite being a non-traditional NFP program, the SRHD NFP fidelity score is higher than the state national average. This year, most of the nurses have been involved in extra work. I appreciate everyone's commitment and passion to this work. This is for Amanda Duggar and Jackie Post. Kudos to Amanda and Jackie for revamping the SRHD.org website for the youth cannabis and her desire to do good. That's why during the wildfire and smoke event, we couldn't have had anyone better than than Cindy. Kyle Richardson. When the formal request came to activate the Medical Reserve Corps to provide staffing at the Red Cross shelter at Spokane Falls Community College on Saturday. This is a few Saturdays back, by the way. He had already been in touch with the MRC volunteers, putting them on standby, and was able to quickly begin scheduling volunteers for the request shifts. Throughout the weekend, he worked with the Red Cross leads at the MRC volunteers to provide the technical assistance they needed. That was during our wildfire response as well. Robin Albrandt quickly jumped in to support some requests and information gathering that Cindy and Kyle were not able to respond to. Carson Hansen was able to step in Monday morning, providing support for some of the requests coming in the FEPR team and provide backup and relief for Kyle and coordination to the MRC volunteers. And Karma was able to jump in and help with setting up coordination calls through Secures with all of our partners to coordinate messaging and share information about the impacts of smoke from the wildfires. Thanks, everybody. Any questions about our kudos? No?
Questions? Thank you very much, and thank you to all of those members of the SRHD team. It's very much appreciated hard work and commitment. Thank you. So next is our financial report. Ms. Kramars.
So in your packets, you should have a copy of the financial report for the month of October. I'll begin with the funding, and as we invoice for reimbursements for our expenditures in advance for state and federal grants, those have not come in for the month of October, so those numbers are low. Also, we have not received our second half public health appropriations from the state of Washington, so we're at 50% on that category. And then Spokane County contribution, we're at 100%. We received the full $2 million. Thank you, commissioners, for that. We're running at 76% for funding, and then our expenses are at 78%. And again, that's just because of those delayed billings that are occurring. Our budget was projected to be closer to 83% of expenses and revenue, but as I mentioned in prior financial reports, that our budget was a bit overstated with the expectation of the treatment services relocation to happen during 23, which would have had increased expenditures and increased funding. So we're still well within our budget for 23. Down in the lower section of the report, we're at 18% for the unassigned reserves. That is just the snapshot for October. We're not expecting that to dip below the 20% for year end. So our total reserves are at $15.5 million. Any questions on the financial portion of my reports?
Questions for Kim?
Okay,
Thank you
I do
very
have a presentation this month. I was asked to speak about FPHS funding, Foundational Public Health Services. So I put together a few PowerPoint slides that we'll go through today. So Foundational Public Health Services, FPHS, has been around for a few years. It is per RCW 43.70.512, and they're for the governmental public health system. That includes local health jurisdictions, such as the Health District, Washington State Department of Health, the State Board of Health, and then the Sovereign Tribal Nations and Indian Health Programs. It's intended to build the system's capacity and increase the availability of FPHS services statewide. A couple items to note about FPHS funding is that they must be spent in the state fiscal year, which runs July through June. It's not on a calendar year, so July through June. And that needs to be spent in the year in which they're appropriated by legislature, allocated, and dispersed. The funding comes in July and January, and they're lump sum amounts. So when you see the financial reports, those are some of those advance payments of grants that we have, or this is the funding received in advance of our expenditures. So that's why we'll sometimes dip a little bit higher in revenue before the expenses have been spent. One thing to note is that anything that's unspent has to be reverted back to the state treasury and returned to the Department of Health. So it's very structured as far as the timeline that you can spend the funds. FPHS activities at the statewide level cover several areas. We here at the Health District have almost every one of these areas with a few exceptions. It does have, transient accommodations, laboratory. Those are things not here at this health district, but statewide. Otherwise, we have most of those programs here at the health district. FPHS, it has 3 different categories. So within FPHS, we have reinforcing capacity, which is very flexible FPHS funding. Then we have focus area FPHS funding. Focus area is specific to LHJs that each LHJ would receive, so specific to our health district. And then the service delivery can be for our specific LHJ, but also cross-jurisdictional. So we have 3 areas. The most flexible is the reinforcing capacity. I'll go back here briefly. I did want to mention, you may have heard additional important services, AIS. And AIS is an additional level of funding, but is not foundational public health services. So an example of that would be FPHS is defined to be a basic set of capabilities and services that must be present in every community in the state of Washington in order to efficiently and effectively protect all people of Washington. So that's defined for FPHS. AIS are additional important services, but not FPHS, and they're critical locally. And they do not necessarily need to be provided by the local government, public health, for all people of Washington. So you may hear of other important services that we do here at the Health District, but they may not be what is defined as FPHS. Some examples of that would be our immunization program, that we can promote immunizations. That is an FPHS activity, but shots in the actual arms are not considered a foundational public health service. They're considered an additional important service that you would see locally in the area. Another one would be WIC. WIC is, again, an additional important service. It's not a foundational public health service, and so that means it can be provided with other partners as well as the district, but it's not exclusive to the health district. So a 5-year look back on our FPHS funding. I didn't really go back any further because the first year was 227, 360. It was very small initially, and it was the blue ribbon funding that was passed, and it was the first time it was rolled out, and it was for specifically case investigation, communicable disease and immunization outreach and hepatitis C. Those were the 3 areas. It has continued to grow, as you can see. We're now projected to be $5.9 million for 2024, and I'll talk about what those areas are. So here's the breakout between the 3 categories for the $5.9 million. Reinforcing capacity is $2,095,000, and that's important to note. Those are the most flexible. So of all those categories that fall in FPHS funding, all of our programs that are FPHS, we can designate that $2,095,000 to any of those programs where it's needed. The state does not direct us to put them in particular areas. So as long as it's an FPHS program, we can make decisions here at the local level on how that's utilized. The focus area of the $2,418,000, that is specific to the LHJ and targeted for our LHJ to have that foundational public health service in our organization. And they want to have a baseline across the state, so everybody offers those services. And then again, service delivery is 1.4 million, and that is specific to either our health jurisdiction or multi-jurisdictions that we're doing for a region. So that's the breakout of the 5.9. Reinforcing capacity, if we take it a little bit deeper, the $2,095,000, that is much more flexible, can be used in any FPH category. We have currently marked for 2024's budget the immunization outreach, communicable disease prevention, homeless outreach, the data center, admin services. That's part of the reduction to the indirect rate, so everyone will benefit, all programs benefit from that. Smoking in public places, and then environmental public health. So a thing to note here is I have the asterisk on 3 areas. Those were previously focus areas invested to the health district. So environmental public health was dedicated focus area investment for FPHS of $798,000 the first year it came out. So we could not use it in any other area but environmental public health. The year following, they continued to give us the $798,000, but they did not put that restriction, if you will, on it's exclusive to environmental public health. So that's where you can, at the local level, determine is that the funding amount that you need to support environmental public health, or do you need it in another area? And that's also true of IMS outreach and CDP. So this is all the flexible area. The next two, this focus area investment. Go ahead.
Oh, wait, so this is all for 2024?
Yes.
Okay.
Yes.
Thank you.
All for the 24 budget. Yes. So the this next area, focus area investment. Big thing to talk about is flexible funds, and everyone hears about FPHS and that they're flexible, and they very much are flexible in their specific area. So they don't. DOH does not give us a very detailed statement of work. It's what do you need at your local level to provide those services and the activities that are needed, but they don't dictate how you do it, or you have to do a checklist. So it's flexible in how you utilize it in your area, but it's not flexible to use in any area within the health district. So just wanted to really emphasize that. So for example, the CD-IMS outreach and response is $300,000, and it's targeted for IMS outreach. We may at the health district here need $400,000, but $300,000 is dedicated, or perhaps we need $200,000, and we would like to redirect the extra $100,000. We're not able to do that because it's not flexible to cross between the programs. New this year is strengthening fiscal capacity. So $62,000 was designated for our contracts and procurement area, recognizing that things are growing and expanding, and that's a big area that we needed some support. Our communications department, for the first time, has received public health communications funding, $200,000. So in our budget, it's typically been local dollars supporting communications, and now we have $200,000 towards communications. A new area is EPH leadership, $150,000 for funding and expenses specific to the leadership in that division. Emergency preparedness and response also received for the first time FPHS funding. We've been typically working with just our federal grants and some state dollars, but now we have $237 this coming year. A new category, life course, started in 23, about $600,000, and then in 24 they really expanded it and increased it to 1.319, and that also includes $150,000 for illicit substance use. So that's essentially a program that we're it covers maternal child health. There's a lot of areas within Life Course, but it doesn't define which ones you have to utilize, so we can design our Life Course program here as needed. So we have that flexibility. But 2.4 million is targeted. And then the next group, the last group, is service delivery. So these are the multi-jurisdictional funding. It's either here at our health district or we're doing regional approach. And you can see here we have data center in 3 areas. We have the shared epi that's done, our CD, hepatitis C, and tuberculosis. TB has some funding. Last year was the first year, or 23 was the first year. Now, environmental public health, the 798,000 that we received moved to reinforcing capacity. So that's not specific to EPH, but we've chosen to continue that same funding level. But these 3 new areas of environmental public health, lead exposure, toxicology, and climate change response, are dedicated for those areas. So again, like for example, toxicology, it's $15,000. We may not need that much, but we can't utilize it in any other area. We may need more, and we can't redirect, or we could redirect from the reinforcing capacity. We also have the child death review. That we had a child death review program some years back, and the state's bringing that back to review all deaths, I believe, under the age of 18, and they have a committee that will do that. So dedicated funding, and then of course now we have case investigation capacity, which also goes towards some of those epidemiologists. And so this again is the service delivery that is multi-jurisdictional. And I'm open to any questions. The big thing I wanted to emphasize is that there's a lot of talk about FPHS and that it's flexible dollars, and it really is flexible if it's reinforcing capacity. You can use it in any of those categories for FPHS. And it is flexible even if it's targeted. The statement of work is really what do you need at your local level for your programs. But we can't cross between them. So that's where it gets a little sticky. We have to monitor them really closely. And then the expectations of the state, we would have to send the money back to the state, which they really don't want us to send back. And we really do want to utilize it to the extent we can. But there are the 3 categories that we have to abide by.
Questions
this is
for
more on the financial side. There's a lot to talk about FPHS. I think the county leadership conference recently had a presentation too.
questions for Kim? Thank you. That was a very thorough presentation. Appreciate that.
Thank you.
So now that brings us to our health officer report. Dr. V, take it away.
Good afternoon, everyone. I don't have a full report today since we have 2 presentations that are part of the work from our teams, but I do have a quick update for you on ongoing situation that we're managing that I wanted to make sure you have the latest information possible. Yeah.
The reports are first.
Oh,
before
then
we're
we'll
on.
have the reports first, and then I'll close it up. That's even better, better strategy. So I think the first report is going to be by Kayla Myers, Immunization Assessment Promotion Health Program Specialist. She's going to talk to us about immunization. I just came up here to give you this. See. That's the pointer. It's just,
All right. Good afternoon. Thanks for having me. Let's see. Perfect. So as he said, I'm on the Immunization Assessment and Promotion Program, and I want to share some updates about the work we've been doing. So first I want to start out by introducing our whole team. We have our amazing manager, Cindy Thompson. I am the program coordinator, Kayla Myers. Sharon Delaney is our intermittent public health nurse. Irina Semko is our community worker who specializes in the Slavic community. Dulcie Shervy is our records assistant. Carlinda Jabjulan is our community worker for the Marshallese community. Irina Gusarenko is our regional childhood vaccine program site visit representative. And Lacola Watson Holton is our administrative assistant, and Carrie Lidbeck is our community network specialist. So that's who makes up the immunization team right now. So in addition to offering clinics throughout Spokane in areas that have the highest uninsured, underinsured individuals and disproportionate barriers to accessing vaccination services, I wanted to share some additional projects that we have been focusing on to improve uptake of recommended vaccines and improve the data that we use to determine the highest pockets of need in our community. We are also exploring new ways to utilize data sets to target specific schools to help improve their vaccination rates. So first, our program has been engaged with our internal communications team and a third-party contractor, MTR Communications, to create and launch a vaccine campaign throughout Spokane. You may remember seeing some of these images up on billboards throughout. In fact, there was one on Boone in between Washington and Monroe. We also have been working with MTR Communications to post targeted social media content and digital ads. So the goal of the campaign was to share immunization messaging and resources across multiple platforms. We wanted to maximize impressions and increase awareness of acceptance of vaccines. The objectives were to overcome resistance to vaccines while building trust to increase immunization rates in Spokane County. We wanted to target female parents or guardians of children 12 years and younger in Spokane, with the emphasis on schools and zip codes with low vaccination and high out-of-compliance rates. So we have had a great response to the campaign so far. This is the information shared by MTR Communications, where they track how many people see each post, ad, and billboard. We've had over 600,000 impressions on social media ads, over 500,000 on billboards, and over 400,000 impressions after retargeting content. We will have more information at the conclusion of the campaign that will measure impressions and click-through rates, meaning those who actually engaged with our ads and clicked the ads to find out more information. We have expanded this campaign to include the respiratory campaign that you may have been seeing around town and online, the Breathe and Easy billboards. That's to remind people to get their flu, COVID, and RSV vaccines this winter. Another group that we work with is Village Reach. We've been partnering with them on a few projects to identify focus areas and to implement process improvements. Recently, we've had them help us gather feedback on our vaccination efforts from our community partners. The objectives were to conduct interviews with our community partners to better understand barriers to access, what was working or not working with the approach that we're doing right now, and what more could be done. Village Reach interviewed 11 organizations total that were comprised of community organizations and service providers, as well as schools and university partners. The communities represented by these organizations included K-12 children, low-income children and families, disproportionately impacted ethnic and racial groups, people experiencing homelessness, people accessing harm reduction and addiction treatment services. So the key takeaway was that the partnerships that we have cultivated over the years were an effective model to expand our vaccination outreach and services. The mobile vaccination model we have been using since 2014 is effective at reaching those who are underserved and improves equity by meeting people where they're at. It was also easily expanded and adaptable to different environments, audiences, volunteers during the COVID-19 pandemic. Village Reach was able to confirm and expand on the various barriers that we had assessed before the pandemic. This project and our program helps to reduce obstacles for individuals and families when it comes to vaccinations. We strive to make sure the services we provide are convenient and comfortable and approachable. Trust barriers are valid and real in most of the communities that we serve. Our program has prioritized populations that have a strong distrust in health systems, skeptical of the information shared through medical and government channels, and those who have lack of insurance. By consistently offering vaccines in locations people frequently visit or utilize services, we are able to build trust and help share accurate information about vaccines. Many individuals stated that if we weren't there, they wouldn't have gotten the vaccines and they would not have gone elsewhere to get them. So what are we doing now? We are taking the information shared with us and incorporating it into our program strategic plan, objectives, and activities. We held workshops to deep dive into 3 areas: the Slavic community, universities, and school partners. We were able to identify areas where improvements were needed and what areas hadn't been addressed before. We have taken these lessons learned and incorporated them into our grant proposals. Our team reviews them regularly and when we work on our grant deliverables. We are working with community partners to strengthen our relationships, processes, and future plans. All right. Oops. So the third project we wanted to talk about was our school data. So the Department of Health uses school-reported data when they share school vaccination rates. Some school districts are enrolled in the Washington Immunization Information System school module. This allows for schools to access medically verified vaccination records, run coverage rate reports, and populate letters to notify parents when their student is out of compliance. When a school district utilizes the school module in the IIS, the school district doesn't have to submit an annual immunization report. DOH can pull the information from the IIS directly. So not all school districts are participating in the school module in Spokane County, but our program continues to promote this functionality and encourages school nurses and administrators to enroll. So this chart is a chart of common diseases that the CDC and various medical organizations recommend children are vaccinated from at specific ages, and the estimated herd identity threshold, or herd immunity thresholds, which is the HIT, and the routes of transmission. This is the coverage rates that we need to strive for as a community to ensure that we don't have an outbreak. So these are the current vaccination rates in Spokane County for the diseases on the previous slide from Washington Immunization Information System. Three groups that our program follows closely are the 19 to 35 month age range or daycare age, the 4 to 6 year olds or kindergarten age, and 11 to 13 year olds or middle schoolers. You'll see the daycare age group in dark blue, kindergarten is in the teal color, and middle schoolers are in green. The first set of bars of children who have received the recommended doses of DTaP vaccine for their age it's for DTaP. So DTaP provides coverage for diphtheria, tetanus, and pertussis. You can see that the younger age groups are well below the herd immunity threshold for pertussis, which is 92 to 94%. By the time they enter middle school, it appears that 88% of middle schoolers have received the recommended doses. However, if you look to the left, you'll see Tdap on its own. This is the dose that is required for middle schoolers before 6th grade. DTaP is formulated for 6 weeks to 6 years. Tdap is a required booster dose for middle schoolers, and you can see that only 66% of children in Spokane County who are 11 to 13 years old have received this dose. As you review the rest of the chart, you see that each vaccine has a similar trend to DTaP. The younger age groups are lower than those entering middle school, though the 11 to 13-year-old group is showing adequate coverage in MMR, varicella, and polio. The younger age groups are vulnerable to outbreaks of these infections in daycares and elementary schools. All age groups are below the herd immunity threshold for pertussis, and that would explain why we see cyclical outbreaks in our county. All right, so here is the Washington State school immunization rates as the whole state for 22 to 23 school year. The 23 to 24 data was due on December 1st, which is why we have to look at 22-23. So we're going to look at each school district and compare to the overall state data. And the following slides will show the rate for each school district. And before we do that, I want to go over some terms. So we're going to be talking about who is complete, and complete means that they have received all required vaccinations to attend school for that age. So for kindergarten, there's specific ones, middle school, there's specific ones. Exempt means that the child has shown that they is filling out a certificate exemption and has not shown that they are immune to the disease or is not going to get the vaccine either. Conditional means that the child is working towards getting the doses within a series. So in many of our vaccines, we have multiple doses. Hep B has 3, DTaP has 5. So if a student starts day 1 at school with their first dose of Hep B, they would be considered conditional status, and it would be the job of the nurse to follow them and make sure that they complete the 2 additional doses. Out of compliance means that they are not, they don't have the required vaccines. They do not have a certificate of exemption filled out. They are not working towards getting all the vaccines needed as in a conditional status. All right, so here's a list of school districts in Spokane County that are required to report vaccination rates to the Department of Health. Our primary focus is on the out of compliance. In essence, this means that their parents are not showing proof of vaccination, signing an exemption, or being placed on a plan of conditional status. We tried to think of a grading scale to show who we should focus on, and if they were within 1 point of the state's out of compliance rate or better, they get an A, and if they were within 2 points, they get a B, 4 points a C, 6 points a D, and greater than 6 points over the statewide out of compliance rate, they get an F. So we had some school districts that we have been reaching out to which are Spokane Public Schools, East and Central Valley School Districts, and Deer Park School District. These were the districts that had over 10% of their students out of compliance last year. And we are offering to hold school-based clinics within their district in locations that have the highest out of compliance rates and in the areas that have the most needs. We've already held school-based clinics at Shaw Middle School within the Spokane Public School System and Deer Park High School this year. And that is it. Does anybody have questions?
Questions? Mr. Kearns?
What's the most common reason you get for the reason from the family and why a child is out of compliance?
Well, generally,
And I'm sure it varies greatly, but what are the most common responses on why the child is out of compliance?
so generally it is just missing like 1 dose, and it's just hard for that family to get in to the providers, or people don't start thinking about it until right before school starts, and it makes it difficult for them to get in. So that's when generally at the beginning of school year is when our team comes in and offers a clinic in a low income or a high reduced lunch rate school, and we try to fill in those gaps. Before the pandemic, we had very good out of compliance rates at all schools, like below 4%. And so it's just also people, I think, getting back in the swing of things and prioritizing it. And administrators were a lot more prone to crack down before the pandemic, and now I think they're prioritizing keeping kids in school, which I understand. But if there is an outbreak, then a large portion of their kids will have to be excluded.
Other questions? Kayla, thank you very much for the presentation.
Thank you, Kayla. We have another presentation for you by Allison Wiley from Environmental Public Health, and she's going to talk about temporary food establishments. And you will tell them the acronym, which I had to learn years ago. So this is and this is to advance.
As Dr. Velasquez said, I am Allison Wiley. I'm an environmental health specialist in the food safety program, and I'm here to talk to you about temporary food establishments, or what we refer to as TFEs. So just to give you a start, this is a look of the food safety team. So I'll stand closer to the microphone at SRHD. We do rotate throughout the county about once every 3 years, so we are looking to have a shift at the start of the new year, and this map will no longer be relevant, but it does still provide a good look at who is up there on the 4th floor. So we have our program manager, Eric Meyer, and our technical advisor, Jessica Martin, and our other office support staff are our administrative assistants, Chantel Zettel and Holly Sims. After that, you have our 10 inspectors, including myself, and we split up the over 3,500 brick and mortar permanent restaurants in Spokane County, as well as inspecting these temporary food events and establishments. So what is a temporary food establishment? A temporary food establishment is a food vendor that operates with a fixed menu in conjunction with a single community recognized event, such as the Spokane Interstate Fair, Pig Out in the Park. They operate at a fixed location. and for no more than 21 consecutive days or in conjunction with a recurring event. And when we say recurring, we mean something that happens on a regular scheduled basis, like a farmer's market that might occur every Tuesday throughout the summer. So temporary food events can have a lot of different permits at them. We see farmers that take advantage of those farmers markets. They might come with their eggs, they might come with fresh meat that they grow and have butchered at a WCA approved slaughterhouse. They will also bring their farm fresh produce. As long as they have just unwashed whole produce that's exempt from permitting through us. Those who want to bring eggs or want to bring their home-raised beef or pork or chicken, they do have to have a USDA or WCA processor's license for that, and then in addition, a temporary food establishment license with us at SRHD. After that, we have our food vendors. They make up the bulk of temporary food establishments. Those are those individuals who are going to prepare food for you right on site. You're going to purchase it. They're going to provide you a ready-to-eat meal. And last is food trucks. They can carry a temporary food establishment permit, or they can choose to be permitted on an annual basis as a mobile food unit. So talking about breaking down those TFE permit categories, we have level 1 TFEs, level 2s, and level 3s. This is just a rank of complexity of the food that you serve, the complexity of the food preparation that's going to take place. And then we also have some exempt foods and exempt with approval. Exempt means it's a food that is specifically listed in the WAC that you can serve it without having to be permitted. Exempt with approval is, again, food specifically listed in the Washington State Food Code that can be served with exempt from permitting, still following the rules of the code, with approval from the agency. So how we determine the permit categories, and permit categories are agency specific. These may change based on the LHJ that is within your jurisdiction. We use application for permit, and you can find this in your binders. So on the second page of that application, we require our applicants to fill out their menu items, ingredients, prep steps, and that's how we're going to review and determine that complexity. So level 1s, we're looking at really simple foods, reheating hot dogs, corn dogs, popcorn, pretzels with pre-made canned nacho cheese. Level 2s, we're going to step it up in complexity, but still using pre-cooked products. So maybe they're going to bring in to play chicken strips, French fries, things that need a little more prep. And level 3s is anything where raw meat comes into play. As soon as you're bringing raw meat into there, level 3 is where we're at. So looking at TFE permits issued in the 2022 calendar year, you can see the bulk are those level 1 permits. We issued 156 level 1 permits, 74 level 2 permits, 74 level 3 permits, and 60 level 2 permits. And something important to note about our level 2 and our level 1 permits, because they are lower risk, we're able to offer those in an annual option, which means you can hold a level 1 or a level 2 permit for 365 days from the time your application is approved, as long as you're operating with that fixed menu we approved and in that approved setup. And that tends to lead to why there's a little bit higher rate in those level 1 applications. So just to touch briefly on those foods that you can serve without having to have an application. So foods that require a permit, that's going to be foods being actively handled in their ready-to-eat form, and foods requiring temperature control. We refer to these as TCS foods, time temperature control for safety foods. It's a bit of a mouthful. And then foods that do not require a permit, that's going to be your candy, packaged baked goods, cans of soda, bottles of water, sauces, jams, or jellies that are produced by a WCA approved vendor. So when talking about applying for your temporary food permit, again, you can reference this application if you want more details. We do ask that vendors submit their applications at least 14 days in advance. This gives us time to review the application and communicate with the operator well before the event to ensure they have a successful operation. Applications can be submitted to us by email, postal mail, fax, or they're more than welcome to come in person to the 4th floor and complete it all at once. We have a lot of operators that's their preference. So talking about our permit fees, TFE permit fees are evaluated about once every 3 years, and that's based on the total cost it takes to run the permit process and the inspection process. So level ones, they're going to be our cheapest option. This is because due to their low risk nature, they don't get an in-person inspection. Everything will be taken care of over the phone during that application process. Level ones can get an in-person inspection if we notice that they're operating in an unsafe manner. Level twos and level threes, you're going to see that price increase, and that's because these both do get in-person inspections. So when talking about how we permit it, all TFEs have to go through a TFE interview. So applicants submit their application to us, we review it and assign it a risk category, they pay their invoice, and then we conduct a TFE interview. So when we're conducting that TFE interview, we start by looking at big picture things like how are you going to set up your booth? What's your cooking equipment going to look like? What is your cold holding equipment going to look like? And after that, we start to look at those smaller picture things. Do you have a digital thin stem thermometer that's required by the code? Do you meet the requirement to have a Washington State Food Worker card? What type of sanitizer would you like to use? And do you have the test strips to make sure it's at the proper concentration? So we always make sure that our operators are prepared to answer questions about their food service and operation. And once that interview is conducted, we are ready to issue the permit. So commissary kitchens are a requirement for temporary food establishments, and this is one that takes some of our operators by surprise, so I thought it was worth mentioning here. So any operator that's going to participate in an event that lasts greater than 1 day is required to have a commissary kitchen. And a commissary kitchen is just a brick and mortar approved commercial kitchen where they can store their food, wash their dishes, do advanced preparation, because we do not allow any home storage of your equipment. We don't allow you to wash your dishes at home or prepare food at home and then transport that to a commercial event. When you're permitted through Spokane Regional Health District, everything must occur in a commercial space. Setting up outside in a tent, it's quite a bit different than setting up in a nice commercial kitchen. So having a commissary kitchen, it's beneficial for a lot of reasons in food safety. And really any approved kitchen most likely will qualify for your event. We always tell people you can look if you're a member of a church. It's possible that their church is licensed, and you can ask the church if there's a time you could come in and cook your food. If you're a member of a club that has an event space, that could be a possible use for you. Friends with someone who knows a restaurant. And then another thing some events do is have an approved kitchen built on site. So if you go to the Spokane Interstate Fair, they actually have 3 brick and mortar commissary kitchens that are permanently built on site at the fairgrounds. And our vendors are able to use those for not just the fair, but any other events that occur year round. And then Pig Out in the Park and Hoop Fest, they actually build kitchens out of temporary equipment for our vendors to use, and it's a very nice resource for them. So then talking about proper booth setup, you'll also find a handout in your packet on our temporary setup checklist, and we provide this packet in both English and Spanish. And on the back side of this, this picture is what is on the back side for our operators. So this checklist is a really good resource for them because it's kind of like a mini version of the application in my mind. It's like that day of checklist, everything that we talked about with you. This is kind of the physical, don't forget it last minute. And it shows a really nice image of how to set up a portable hand wash station. Because even though you're outside, you still gotta wash your hands, wear gloves, not make bare hand contact with food. And this image, I really like it because it shows how flexible a portable hand wash station can be. A lot of our operators, cost is a really big concern for them, and showing them that this is something that you can build yourself. You don't need to special order this. You don't need to go out and try to find it last minute. That's usually a really big relief for them. And then this booth setup is also really helpful, especially with operators where English isn't their first language. Visuals are always helpful. And at the end of the day, we just really want our operators to be successful. And it creates a very stressful situation for everyone if we show up to a busy event and a tent is not set up properly. Sometimes our operators are having to run to the hardware store to get a free-flowing spigot for their hand wash sink. They're having to move all of their equipment out to lay a tarp down. They're having to go buy a tent. I mean, some people show up and they don't have a tent. And so these are the things we try to eliminate through that TFE interview process, through providing literature like this checklist and this booth setup. And we do try to collaborate with other partners as well. Like on our booth setup, we touch just a little bit into our partnership with the fire department. Fire resistant tents, that is required if you are going to cook inside your tent. It's not our requirement, it's the fire department's requirement. But if we're going to teach you how to set up a booth, we might as well cover that too, because there's no reason to set up a booth for us, just have to take it down and get another one for the fire department. We also talk about how propane tanks should be located outside of the tent, and then just put that little disclaimer that you should contact your fire department for proper distances, and usually they have some fun stuff about what hoses to use and connection valves are required that goes a little bit above our head. So TFEs tend to be one of the more complex parts of our job. They come slamming into us in the summer and we're go, 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 and then they disappear in the winter and we rest up to do it all again. So that was your crash course on a little bit about temporary food establishments, and I'd love to answer any questions if you have them.
Questions? Commissioner.
So over the years, I've had many folks when they're set up at different community events, the one thing they complain about is when they're on grass and they have to have the tarp on the ground.
Yes.
They always complain that it's a tripping hazard, that if water gets on grass or grease gets on the grass, it's not a slipping hazard, but when water or grease gets on a tarp, then it's slippery and they've had falls. Why is the tarp required on grass?
Yeah. So we can look at it from a couple different angles. We can look at it from a pollution prevention angle. We don't actually want gray water and grease and food debris going into the ground, into the grass, where it can leach into our groundwater. And then looking at it from a food safety standpoint, we want that space to be as enclosed as possible because we don't want potential contaminants getting stirred up and then affecting our food safety. And Ray, can you comment if I got that correct? Yeah. Yes, it is a requirement of the Washington State Food Code.
And I mean, I have never looked into this, but several of these vendors have told me when they travel around the state, other areas in Washington, they don't enforce the tarp on the ground. So it's just what I'm told. I have not looked into that, have not gone to those other events, but that is what many of the vendors have said, was we're one of the few communities that does enforce the tarp on the ground on grass. So
Yes, and it is a Washington State Food Code requirement for the whole state that a tarp be used if a vendor is set up on grass, gravel, or dirt, the only exceptions being concrete or asphalt. Okay, well, thank you for your time.
Thank you.
Thank you both, Kayla and Allison. And I just wanted to make a comment. A lot of this was about the process and the procedure, but there's a lot that happens behind the scenes. That is not process and procedure that goes along with Allison's statement. Our goal is to make sure people are successful. So as an example, when Thanksgiving was coming around, I know that the team was aware of some restaurants in which either management or chefs had changed. So they were actually out there quietly making sure that the new team was aware of all of the requirements and how can we help you be successful. I know that for Pig Out on the Park, there were some challenges with things that we don't think about, like how can you do a whole roasted pig and Pig Out on the Park. I know the team spent like 3 or 4 days with the vendor making sure that they indeed could deliver that. So these folks spent a lot of time just helping, not regulating, but actually helping. So I just wanted to mention that because one of those things that we probably don't see all the time. And I also want to say thank you to the immunization team because I know they spent a lot of time, particularly with our community partners, making sure that they have access to everything they have. So with that, I have a very quick update for you on a situation that we've been managing for a little bit of time. So I want to make sure you have as much information as possible. And it has to do with a Shigella outbreak that we have in the community. This is actually straight out from our Shigella Outbreak Planning and Response SRHD Situation Report number 1, which is in your packet. It's part of, I want to say kudos to our Public Health Emergency Preparedness and Response team, FEPR, has spent a lot of time updating all of our processes and procedures, and from now on, you will have the discipline of us sending a situation report to stakeholders. We have distributed that, and the reason why my phone was buzzing is because it was also being sent to all of our employees. So I want to make sure that everybody's aware of what we have. But what it boils down to, in late October, we're notified by our clinical partners that they were seeing diarrheal, people with diarrheal disease that also had fever, which is very suggestive of Shigella. So we started a full investigation to the extent that is possible and active for us to do, since most of these folks were folks that are experiencing homelessness. So the team deployed as we typically do. We could not find a specific point of contact, but we did see cases spread around the community in a variety of places. And to just give you an example, as of today, we actually have this morning 42 cases, 14 of them at one of the facilities, and I'll get back to that in a second, and 6 in campers, the rest of them scattered throughout the communities. So since then, we've been engaged with all of the shelter providers as well as all of our community partners. As a reminder, we meet with all of the shelter providers every other Monday. And part of that meeting is to provide information that is important to them. When I wrote the slides yesterday, was with information from the day before was 37. Now it's 42 as of this morning. But the reason why I'll bring that up is because Shigella is not an uncommon bacteria. It's actually around. We do see it. It does cause a lot of infection around the country for a variety of reasons. There's 4 species. We have 2 of them, and the 2 most common ones is what we're seeing. That is the little bug that you see here. I'd like to point so my friends in microbiology like to show pictures. I will show that to you. But it is something that basically is oral fecal route. There's really no other way. And what I mean by that is if you have appropriate hygiene processes, procedures, like for example, if I were to get it, I will be very careful washing my hands and making sure there's appropriate disinfection, etc. So it will be very difficult for anyone in my household to get it. But that's not true of all of us. But we do remind people that there are a lot of ways you can get it. And it is important to make sure that proper hygiene and sanitation is present everywhere where there's someone that is infected and potentially infectious. One of the concerns that we always have is in places in which food is being served. So many of our shelters, as you know, there is food. So we have been working with all of them since early November, providing them guidance. I know the team has deployed and done visits. I know our partners in environmental public health have also provided information to all of our food establishments to make sure that they're aware of it, and also know that if there's an employee that is infected or infectious, that's an employee that cannot be at work for the time being. So there are many ways of getting it. Includes water and food and other contaminants, but it's pretty much oral fecal route. This is mainly for your information. You have the slides. We do know that people typically, if you have diarrhea and fever, particularly of sudden onset, most physicians will think about Shigella, and most physicians will actually treat empirically with broad spectrum antibiotics. Now, one of the issues that we have is that we do know that a person can shed the bacteria in feces for 2, and some people say up to 6 weeks, depending on the literature, which basically means that even if you are not symptomatic anymore, we do have to be mindful with hygiene, hand washing, and other means of prevention. It is more severe in the very young and elderly people, although we try to not use the word elderly, we say later youth, and people with pre-existing conditions. I coined that term, later youth, and I will continue to use it. Now, this is simple measures that everybody can follow. And as I mentioned, we have provided all of the information to our shelter providers and the folks on the street and the folks on the campus. It's not just the folks on the shelters. And Kira Lewis, one of our public health nurses, did a full in-service for our shelter providers. That includes not only the traditional ones, but we have city and county and healthcare providers, et cetera, et cetera, et cetera. So all of these is information that we provided, and all of these are links that were provided to them along with all the presentations. So we do expect this will continue. As of the 6th, we declare an outbreak at the Trent Resource Facility because of the number of cases that were tracked by that. We've been working with that team. We do want to say thank you to the team there. They've stepped it up. We notified city emergency management, city administration, and the Salvation Army, as well as our board chair, before we declared the outbreak to make sure everybody had the information, because our goal is to make sure that communication is consistent and is clear and is appropriate. So with that, I'm going to stop here and see if anybody has any questions. We will continue updating you as we go forward and look forward to getting more of the situation reports, as this is our discipline. Now, I want to mention that Cindy Thompson also oversees this team. So she's doing double duty, not only the immunization team, but also our emergency preparedness team. That was mentioned in one of the previous slides. Questions?
Questions for Dr. V on this?
Thank you.
Thank you very much. So that concludes our reports for this month, and that brings us to our board member check-in. Commissioner Keeney, Commissioner Waldorf, Dr. Policani, Commissioner Kearns. So your next regular board meeting is January 25th, 2024, and if there is no other business before this board, I will adjourn. Thank you all very much.